Good morning, friends. In the last class, we have seen panchakarma procedures in children, and we have covered up to Snehana portion. Today, we will continue with Swedana. Swedana is another important panchakarma procedure which is included under Purvakarma, which can be very well practiced in children. Meanwhile, Swedana can be used as one of the Bahya Chikitsa in many conditions of childhood disorders. Snehana followed by Swedana is always indicated, and a Snehana which is followed by Swedana over the chest area is good in many Kapha Purna Deha conditions. As explained in the previous class, application of Brihat Saindavadi Taila or any other Lavana Tailas followed by Swedana is quite beneficial in removing the kapha which is accumulated in the chest region, and it also acts as chest physiotherapy. Swedana over the abdominal area by Patasweda is good in certain atypical abdominal colic, constipation, and distension of the bladder, which is commonly seen in infantile clinical practice. Neonates, same can be done in the form of the Hasta Sweda. These are the two important types of Swedana which is mentioned by Kashyapa. Kashyapa explains Patasweda and as well as Hasta Sweda. And both these forms of Swedana are quite beneficial to practice in infantile and neonatal practice. Swedana over the nasal area and also the facial area is quite useful in nasal congestion. Certain Sugandha Dravyas can be added to get the quick relief from the nasal congestion. There are different types of Swedana which is mentioned in the classics. As we know, Swedana has got the capacity to reduce the Stamba, Gaurava and also pain. And this can be modified as Nadi Sweda. Temperature should be checked in each type of Sweda. There are all the possibilities when it is used in children that it can cause burn. So prior to application of any Swedana directly into the skin or body of the child or baby or infant, always check it. There are different types of Swedanas. The most commonly practiced Swedanas which is very common in the childhood practice are Pola Kulaktadi Sweda, Shashtika Shalipinda Sweda, Churna Pinda Sweda, Valuka Sweda, Jambira Falapinda Sweda, Jambira Patrapinda Sweda, Patrapinda Sweda, and these are all the common type of Swedanas. According to the requirement and according to the clinical condition, we can modify this Swedana by adding different types of the drugs, which has got Ushna property. Upanahasne Sweda. Upanaha Sweda is practically, this is quite convenient in childhood practice, and this can be applied for a longer hours. Upanaha Sweda is prepared by the paste of some of the Vatahara drugs, which is mixed with the Amlarasa drugs, with more salt as well as fats made snigdha. By adding the fat, it is made snigdha. In the meantime, it is also added with the salt, and it is also mixed with Vatahara drugs and Amlarasa drugs. The paste prepared by Vacha, Shatapushpa, Kushta, Devadaru, Rasna, Eranda, then Mamsa, Sneha, Lavana, and Amla Dravyas is applied over the thin cloth and then it is wrapped around the involved muscles. Especially, this is quite useful in those conditions where there is contractures or spasms. Conditions like cerebral palsy, conditions like some of the spasm disorders related to upper motor neuron lesion. So there will be contractures. In these contractures, to relieve the pain and also to make the muscles soft or loose or relax, we can go for Upanaha Sweda, which is prepared by the above mentioned drugs. Another type of Swedana is Lavana Upanaha Sweda, Salvana Upanaha Sweda. Salvana Upanaha Sweda is a Upanaha mixture which is very rich in salt. Salt is known for its Vishandana property and also for Vatahara property, and salt is also known for its Anushna Shita and also it is Shoto Shodaka. So, Upanaha mixture is made by the drugs like Kakulyadigana, Vatahara drugs, Amla drugs, and as well as Anupamamsa, Sneha, and Lavana. the proportion of the lavana will be quite more here. It helps in relieving the pain, and it also helps in relieving the sankocha spasticity. Sangabhanga, Angabhanga, Sankocha, it is Vata Prakopa. So in all such conditions where there is Sankocha, contracture, spasm, spasticity, we can go for Salavana Upanaha Sweda. This is quite useful in Kevala Vataja Rogas also. Another type of Sweda which is commonly practiced in childhood practice is Pinda Sweda. Most commonly practiced is Shastikashali Pinda Sweda. Usually it is called as Brahmana Sweda, although it is quite controversial, it is called as Brahmana Sweda. Another type of Pinda Sweda is Jambhira Pottali Sweda. Jambhira Patra Pottali Sweda, that is quite useful in case of Amavata, muscular cramps, Avabahuka, and the stiffness of the joints, etc. Patra Pinda Sweda, which is prepared by different patras like Nirgundi, Varuna, etc. It is quite useful in case of Katishula, joint contractures, and stiff joints. Another type of the Swedana is Dhanya Pottali Pinda Sweda. This is also quite useful in some of the painful contractions and painful conditions. Churna Pinda Sweda can be also used, which is quite commonly used in case of Vata Kafaja disorders. Kola Kulattadi Pottali Sweda. This is indicated in all the Vata rogas. Kola Kulattadi Pottali Sweda is prepared by using Kola, Kulatta, Amrataru, Yava, Mishi, Masha, Atasi, Pushta, Rasna, Tailafala, Narikela, Sarshapa, and Karpasapa. This will be added with the 16 parts of Amla Kanji or Amla Kanji, and the liquid is then evaporated. Then the remaining paste will be grinded, and this mixture is made into paste, and then it is applied. Another type of Pinda Sweda is Karpasa Bija Pinda Sweda, which is also commonly used in some of the painful conditions. Sattha Bandhana is quite useful in childhood practice because as we encounter many conditions like cerebral palsy, muscular dystrophy, spinal muscular atrophies, etc. This is one more type of Bahya Chikitsa applied in children with good results. Lepa of certain Vatahara drugs like Eranda, Rasna, Nirgundi, Bandhaka, Agnimanta, and drugs of Dashamula are taken and paste is prepared. This lukewarm paste has to be applied over the thin, soft cloth. Later, this cloth is wrapped against the affected part tightly and later covered with either Eranda Patra or Kadali Patras. This is quite useful in long-term treatment of muscular contractures, deformities, spasticity-like conditions, which is commonly encountered in pediatric cases like cerebral palsy, muscular dystrophy, etc. Another important Shodhana procedure which is commonly practiced in childhood practice and also mentioned in Kashyap Samhita, so that is Vamana. Everybody will be surprised how we can give Vamana in children. As explained in the previous class, there are limitations for Vamana. It is not the age the limitation is Bala of the child. In Kashyap Samhita, we find a very detailed description of a procedure of Vamana in children. There is a Sandhya Sambhasha taking place regarding the fixation of the age and as well as dose of the Vamana drugs. One of the scholar, Kaustya, he says that the minimum vega which has to be which we have to get in case of children is there is mild is 2 to 3 vegas, madhyama is 4 to 5 vegas, and uttama is 7 to 8 vegas. Whereas another scholar, Parashara, he says Vamana Vega depends upon the Bala of the child. It is not to do anything with the age of the child, and Vamana Vegas in an older child will be more, in a smaller child will be less. One more author in Kashyap Samhita, where the name is not mentioned, he says that Vamana given to the small child may cause Netra and Hridaya Rogas. So he says that it is not safe to give Vamana in children. So he says that the right age for administration of Vamana in children is only after 6 years. Whereas another scholar in this Sandhya Sambhasha, Vruddha Kashyapa, he says that Vamana and Virechana should be given to the child mixing the drugs with sharkar. And this can be practiced from 4 to 8 months onwards, that is in the infantile periods. Another scholar says, Vaidehi Janaka, that Vamana can be given in the small case. But the drug which has to be used is Nistusha Apamarga Bija. Instead of Madanaphala, he says that Nistusha Apamarga Bija should be given for Vamana. And it can be safely practiced in small kids. Another scholar, Vayurveda, says Vamana should be given to Dhatri if the kid is very, very small. This is what Ayurveda says. He says that instead of giving medicine to the kid, you can go for the Dhatri, because the Dhatri or mother is the one who feeds the baby. Therefore, doshas present in the mother or Dhatri will also come to the baby, and that is responsible. Therefore, better to treat the root. Root is Dhatri or mother. Another scholar, Vaksya, says health of the baby is directly related to the mother or the Dhatri, so give Samshodhana to the mother instead of kids. At times, Vamanopaka drugs can be given to get the same effects. And we know that in Charak Samhita also there are some Greya yogas are mentioned in Siddhistha. And that can be also used in pediatric practice. Because Greya means just by smell, the child will going to get the vomiting. Panchakarma in pediatrics, Vamana, if you continue the topic, by the previous discussion of Sandhya Sambhasha, which is shown in the last slide, it is quite obvious that the procedure of Vamana is subjected to repeated trial and error method by the scholars to find out the best possible practical oriented methodology. At the end, it is concluded by Kashyapa that Vamana should be given as per the demand and strength of the child and nothing to do with the age of the child. Child who frequently omits or child who is frequently omitting after taking the breast milk will not suffer from Daiva and Manusha disorders. This is told by Kashyapa. He says that. Again, this shows the importance of Vamana. Child after taking the feed, which is frequently omitting, will very rarely suffer from the disease of Daiva and Manushi. That means external and internal disorders, as it frequently omits the vitiated doshas out. Therefore, he says that Shishor Vyado Samutpanne Datrinam Eva Shodhanam Ataha Balam Sukayeti Ko Lokena Vabudhyate. And this reference is present in Kashyapa Siddhisthana, 3rd chapter, Vamana Virechaniya Siddhyati. So, from the above last two slides, it's quite clear that the Vamana can be practiced in children, and it is also mentioned in Kashyap Samhita. Only thing is, physician has to use the yukti. Now come to the next procedure, that is Virechana in children. It is a well-known fact that Virechana is best for Pittaja disorders, and it imparts the clarity of the Indriyas and good for ensuring the growth and as well as development of the child. It also enhances the functional capacity of the child by purifying the Amashaya, Takvashaya, and Garbhashaya by regularizing the bowel habits. The child feels lightness of the body and there will be Agni Deepti. But in spite of all the advantages, Virechana has been better avoided in children except in emergencies. This is very clearly told in classics. In the first 3 lines, that is Kashyapa says, these are all the benefits of Virechana if you give in children. But still, the Shastra says that it is always better to avoid Virechana in children, and in any absolute indication of Virechana should be substituted by Basti, and Virechana is only limited for emergencies. All the advantages, indications and contraindications are explained in Kashyap Samhita for the Virechana. And to some extent, the explanation given by Kashyapa in terms of Virechana is also matches with the adult indications. Now, Virechana in case administered should be given at least 15 days after Vamana by fulfilling all the prerequisites. This is told by Kashyapa. If you want to give Virechana in children, you should be given at least after 15 days. Almost all matches with the protocol which we follow in adults. The drugs like Danti, Shatfala, Trivrit, Kampilaka, Vacha, and Vishanaka, etc. are given individually or altogether, processed with one prastha of water and the gomutra, and given for drinking in kashaya form. This should be given in Shankhakriti Patra. Kashyapa says this should be given in a Shankhakriti Patra after mixing it with butter and can be made into Leha form also. In Fakaroga, we know that Trivurt Kshira Virechana is indicated. 10, 15, and 30 Vegas of Virechana is considered as Hina, Madhyama, and Uttama Vegas, while 4, 3, 2 Prastha of the total medicine eliminated after the Virechana are considered as Uttama, Madhyama, and Hina Vegas of the Virechana. This explanation is given in Kashyap Samhita. Revati, one of the Graha or Jataharani also, is curable by Virechana in childhood practice as per Kashyap Samhita. Now we come to another procedure, that is Basti. In childhood clinical practice, Basti will act like the Amrita. Shishunam, Ashishunam, Basti Karmam, Amritam Smrita. It is just like a nectar. It gives money, it gives name and fame to the physician. It gives the Ayusha or life to the child, and it gives the offspring to the parents. So when it is used as for the classics. Again, Kashyapa warns that if it is not used in a proper way, it can destroy all three persons. All the diseases of the pure Vata and diseases with the association of Vata, the Basti Karma is best. As already we know that Basti Chikitsa is half chikitsa. Now, while explaining the age limit for the Basti in children, again there is a trial and error method has been followed. That means there is a Sandhya Sambhasha taking place as explained by Kashyapa. Now, especially for the age at which the Basti has to be initiated in children or started, the one of the author that he says, Gargya, he says that it should be given immediately after birth. Yes, immediately after birth in the newborn, Basti has to be given. This is a version of Gargya. Okay, but Mathara, another author, he says it should not be given immediately after birth. Rather, it should be given after 1 month. He says after 1 month, the child will be little stabilized or stiratva. Child will get the stiratva, and therefore 1 month of age is considered as the right age of introduction of Basti. Another scholar, Punarvasu Atreya, says, and these are the names mentioned in Kashyap Samhita. Now, this Punarvasu Atreya, whether he is related to Charaka Sampradaya and all these things are debatable, but this name is mentioned in Kashyap Samhita original text. Punarvasu Atreya says this should be given after 4 months. This should be given only after 4 months, not immediately after birth and not even after 1 month. Because after 4 months, he says organs up to 4 months, the organs are not much matured and they are functionally and structurally not fit. Therefore, you give it only after 4 months. Another Acharya, name is missing in Kashyap Samhita. Another Acharya, he says that Basti should be given only after first year. So, why he says that the chance of getting Santarpanottha Vikara after 1 year, if we start, it is best. He says that it should be given only after 1 year. The reason is, if you give before 1 year, there is a chance of child getting a Santarpanottha Vikaras because child is already taking the Sneha Dravyas like milk and Grita, etc. So he says that to avoid such Santarpanottha Vikaras or chance of getting Santarpanottha Vikara in future, better to avoid till first year. Another author or scholar by name Parashara, he says that Basti should be preferably given only after 3 years. He says that up to first 3 years, it is difficult to look after the child. Again, the concept of Swatantra Bala. In Swatantra Bala, it is very difficult. Rather, in the concept of Paratantra Bala. In Paratantra Bala, it is very difficult because he is depending upon others. Swatantra Bala can take care of himself. So he says that up to 3 years, it's better to avoid. After 3 years, you can go for Basti. Another author, Bhela, says Basti should be given after 6 years. He says that in 3 years there is less intestinal capacity. In the first 3 years, it should not be given at 3 years, because in the 3 years the intestinal capacity is less. So Basti, whatever you have given, that will not be held properly there, or it will not retain. The retention will not be for more time. Therefore, it will not give much result. Therefore, he says that it should be given after 6 years. What is the final conclusion of Kashyapa? So criteria fixed by Kashyapa for administration of the Basti. Now lastly, after listening to all these opinions and different clinical experience by the different authors, so now lastly, finally, Kashyapa gives the opinion. The criteria fixed by Kashyapa for administration of the Basti is very simple. He says, Adhastanoho Annabhoktaha. That means that Kashyapa finally says Basti can be administered in all those kids. The criteria are as follows. Number one, child who is completed the neonatal period, that is after 1 month, early and late neonate after 1 month. That means in the infantile age, can be given with Basti. And child who is able to crawl and sit and stand with support, that can be also given with Basti. This is somewhere around 5, 6, and 7 months. Child who is able to take Anna daily, that means after starting the complementary food or external food. And child who is started weaning from the breast milk. That means child is not on exclusive breastfeeding. Now he is also taking some other food materials. And this corresponds roughly, all these first four criteria roughly corresponds about 6 to 8 months of life. Of course, Charak has not mentioned the exact age. He says that Adahastanoho Annabhokta. So we can draw a criteria by considering this Adahastano Annabhokta, that child who is completed in neonatal period, able to crawl, sit and stand with support, and also who can take Anna daily, and child who started weaning from the breast milk. And now if you take an average, it corresponds to 6 to 8 months of life. Therefore, we can say that this can be given in 6 to 8 months of life according to Kashyapa. Now, materials which are used for the Basti in children are vessels prepared by using the gold, silver, copper, bronze, tin, lead, iron, ivory, bamboo, horn, bone, reed, and other similar article according to the situation and possibilities. The material should be smooth without any spikes, uniform, straight, and also without any orifice and leakage point. It should have the proximal end with a tapering, distal end resembling the tail of the cow. Method of administration of the Basti is very specific, and child receiving the Anuvasana Basti priorly done with parisheka with lukewarm water and applied with fragrances. Before the use of Anuvasana Basti, massage and the irrigation with the hot water should be also done to the anal area. Following one Astapana Basti, next day Anuvasana Basti should be given, and in this method, the physician should give the Basti in the alternative days. Daily use of Basti may be harmful. That is, daily use of Anuvasana Basti or Astapana Basti may be harmful. Of course, we know that Matra Basti can be very safely practiced. A special type of Basti Dravya Sneha, Basti Dravya Sneha, has been mentioned by Kashyapa, and that is called as Shaishuka Sneha. This is only explained by Kashyapa. This is a Shaishuka Sneha, is a special type of Basti Sneha which is mentioned for children by Kashyapa. Basti is considered as best treatment in disorders of the childhood, as we know. Basti will cause the Brahmana from tip of the nail to head. That means all over the body. This is also responsible for imparting the complexion, varna, luster, strength, longevity, and as well as it increases the shukra also. It causes cleaning of the yoni or cleaning of the yoni, and also provides the offspring for the infertile woman. See, this is not only for the child, it is also mentioned that even for the infertile woman also it is good. This cures the disease of Vata and disorders associated with Vata. A very important aspect has been mentioned in Kashyapa, where he says, in those days, this particular sentence reflects the social conditions of those days. Children of rich people or luxurious family, who is referred as Rajaputras, who get emaciated due to indulgence of excess coitus before attaining the appropriate age. That means early induction of coitus and sexual activities, okay, before proper development of the body may lead to emaciation and so many other problems and disorders. And Kashyapa says, even for such kids or such pediatric population also, that is in the adolescence, late adolescence period, the Basti is quite useful. Another procedure which is mentioned in Panchakarma in Kashyapa Samhita is Nasya. Nasya can be given in Bala and it is of mainly two types. Brahmana and Karshana are the two varieties of Nasya. Swedana and Purana Nasya are other two varieties of Nasya explained by Kashyapa. And Kashyapa very clearly says Nasya can be also given by breast milk. Even breast milk installation to the nose can be also done. He says Katu Taila Nasya has been explained for the children along with Madhu and Gomutra by making the baby sit on the lap of the mother or Datri. If the situation demand a Nasya procedure in a child, and if the child is reluctant to take the Nasya, Kashyapa says that it should be given forcefully to prevent the future complication. If you don't give Nasya, it will lead to some of the future complication. Therefore, if the child is reluctant also, you go for Nasya. This is explained. Nasya cures certain childhood disorders like Trishna, Shiroroga, and Pipasa according to Kashyapa. One of the Nasya material, that is Kumara Taila Nasya, is specially mentioned or indicated for the child, which is best for eradication of the disease. Kumara Taila Nasya. Child which is on the breast milk should receive the Nasya karma. All these references are from Kashyapa Samhita, especially the Katutaila, Purana Grita with honey, mild massage and should be done before Nasya. Then this Katutaila and Purana Grita with honey, anyone can be applied. And later the nose should be pinched by the digital pressure because baby cannot squeeze it inside. In adults we can say to squeeze it inside, but baby cannot do it. For that he says that it should be nasal area should be pinched with the digital pressure. This procedure should be done daily till the complete disappearance of the disease. Now panchakarma practice in Fakkaroga. Fakka is one of the main disease explained by Kashyapa Samhita. Clear-cut reference about the application of panchakarma is mentioned in Fakkaroga with more Vataja symptoms. If Fakkaroga with more Vataja symptoms, Vata Prabala, then Snehana, Swedana, Udvartana and Basti are clearly mentioned. Trivat Kshira has been taken for the Virechana also. Amritagrita, Kalyanagrita and Brahmi Grita are also mentioned. For the Abhyanga, Rajataila has been mentioned, which is very popular. If we consider Fakka as failure to thrive, how to consider Fakka as failure to thrive? What are the correlations that we will see in another class? If we consider Fakka as failure to thrive, then practically implementation of the Shodhana is not possible in children because Shodhana is always one of the prerequisite is Bala of the child. A child with the FTT or Fakkaroga, the child is very weak and emaciated. So we have to stick basically on Purva Karma and Bahya Karmas. Purva Karma as well as some of the Bahya Karmas with internal medications. Shirapaka method can be also followed while treating the Fakkaroga. So what I mean to say is, as Fakka is totally physically, emotionally and mentally disabled condition with the emaciation of the body, immunocompromised child, or in other words to say, failure to thrive like condition, the classical administration of Panchakarma is quite doubtful. Of course, if you ensure that the Bala of the child is good, then we can go for some mild Panchakarma procedures, especially Basti. Instead of Vamana and Virechana, Basti is quite beneficial, even in case of emaciated child. Now, some of the Panchakarma procedures which can be followed in cerebral palsy are, if there is a hypertonicity, we know that in case of cerebral palsy, spastic cerebral palsy is most common condition and hypertonicity is the main problem. So we can go for Abhyanga, Lepa, Agni Lepas, Udvartana procedure, Pattabandhana, Basti, Matra Basti like conditions, procedures and Shirodhara can be given. Panchakarmas in muscular dystrophies, commonly seen as Duchenne's muscular dystrophy, can go for, we know that it is Asadhya Vyadhi, but to give the symptomatic relief, we can go for Deepanapachana, Abhyanga, Lepa, Udvartana, and Basti, especially Matra Basti. Panchakarma in certain skin disorders. Deepana Pachana should be given in the beginning, followed by Gritapana. And we know that in skin disorders, always Tikta Gritapana is very good. Tikta Gritas or Indu Kanta Grita can be given because sometimes children may be reluctant to take the Tikta Gritas as Snehapana. Mrudu Virechana can be given by Virechanokono drugs or Tribut Kshira, Lepa, Abhyanga, and Sira Veda to some extent, and Jalokcharana, and Avaga and Parisheka. The last one, Avaga and Parisheka, most of the time in skin disorders with the oozing and all, is quite beneficial. Bronchial asthma like conditions in Panchakarma can be given Snehana, and we know that Virechana is good. Vamana, Vasantika Vamana is also good. Uro Abhyanga can be done, Uro Lepa can be done, and Mrudu Vamana, Sadhyo Vamana can be also practiced in some of the acute conditions. It is quite beneficial. Hemiplegia, most of the time we get cerebral palsy associated with the hemiplegia sometimes. So we can go for Abhyanga, Lepa, Shirodhara, Basti, and Nasya. Nephrotic syndrome like conditions also we can go for some of the panchakarmas. I'm just giving the headings and I will not going in detail about these procedures. Detail facts regarding how to administer panchakarma in nephrotic syndrome or cerebral palsy that we will see in the next class. Abhyanga, Mrudu Virechana, Basti, especially in nephrotic syndrome, to some extent Ksharabasti is useful and to some extent Stiradi Apana Basti or Kukutandas if it is added on this Stiradi Apana Basti or Kukutanda Twak Basti, that is beneficial. Egg albumin, that is white portion of the albumin that is rich in the white portion of the egg is rich in what do you say albumin, which has to be supplemented in case of nephrotic syndrome. Therefore, it gives some good results. In obesity, one more burning problem: Abhyanga, Udvartana, Virechana, and Astapana Basti can be given. In some of the cognitive problems, Shirolepha, Shiropichu, Shirapaka by using media drugs, Matra Basti, and Nasya can be given. Certain skeletal disorders, Shira Grita Basti, rickety like conditions or complications of the rickets or some other bone problems, Lepa can be given, Pattabandhana can be also done. In case of joint pain, simple joint pain, Snehana, Swedana by Valuka Sweda, Basti, Lepa, Avagaha, and Pattabandhana can be practiced. In case of autism, Shirodhara, Shiropichu, Basti, and Nasya. Details we will see in coming classes. So with this, I conclude this is the very short introduction of Panchakarma in pediatrics, especially as explained in Kashyap Samhita. The purpose of this particular presentation of class is so many of will have doubt in our mind how to administer Panchakarma in children and whether this is mentioned in the classics or not. To clarify all those doubts, this presentation was made by me to say that there is enough references regarding Panchakarma in children. With this, I conclude. Thank you very much. Hello. Ah. Hmm.